Yeah, so the Post-CAR Prognostic Index, or PCPI, is a novel score designed to predict overall survival after progression to CAR T-cell therapy. So we collected data on like 200 plus patients who progressed after receiving CAR T-cell therapy and identified those variables which had the highest impact on overall survival. Then for each of the variables on the selected cutoffs, patients received 1 point and were categorized into 4 risk categories, being low, intermediate high, or high risk, and identified 4 distinct overall survival curves in the training cohort. And then we proceeded to validate that in an external international multicenter cohort, gathering patients from the United Kingdom, Germany, and France, and observed a good outcome as well, validation in the overall survival curves of the validation cohort. We also conducted a C-index comparison with the IPI and RIPI assessed in the post-CAR progression setting and observed that the PCPI outperformed both the IPI and RIPI in the post-CAR prognostic setting. So we do think it could be an interesting tool to predict overall survival after CAR T-cell therapy progression, considering the increasing patient population in this setting, and to stratify these patients, which are included many times in clinical trials, to identify the amount of patients which were high risk and were included in post-CAR clinical trials. So we think this could be an interesting tool. This was developed with patients who received CAR T in the 3rd or later line setting. So, looking forward to seeing that validates in other cohorts and in the second line, post-second line CAR T setting as well.